10 minutes.
About 15 minutes.
Around 15 minutes.
5 to 10 minutes.
5 minutes.
About 10 minutes.
Around 2 minutes.
10 minutes. 30 minutes.
5 to 10 minutes.
Maximum of 15 minutes. That's if I'm changing clothes.
About in half an hour.
15 to 20. 30 minutes. More or less 20 minutes.
Hello, I'm Dr. Dolores Kent. I'm going to talk to you today about self-breast examination. This is done in conjunction with your yearly visit to your gynecologist or to your health practitioner, and also in conjunction with mammography, which is a radiological examination to look for microscopic disease in the breast. The self-breast examination should be performed 1 week after your menstrual period on a monthly basis. This is because your breast is less reactive during that time period. There are 3 methods then that are used in examining your breast. The first is just to look. The second is to examine your breast either sitting or standing. And the third method is to examine your breast lying down. When you are examining your breast, look in a mirror. Look to see if there's any symmetry, any asymmetry, any change in color. Is there any retraction of the skin? Is there any dimpling? You're going to look to see if there is any discharge, of course. I'm going to now demonstrate this breast examination with a patient. This is my favorite and my preferred method, which is the spiral method, because it is quick, simple, easy, and it only takes a minute. Some people will ask you to examine your breast with your arm actually up behind your head. Can you raise your arm like this? This flattens the breast tissue against the chest wall, especially if you're lying down, and some people find that that's an easier method to use. I personally prefer with the arm down because I think sometimes with the breast tissue flattened against the chest wall, it's harder to actually feel a mass. But I always start underneath the arm, in the armpit, because this way I don't forget that there's breast tissue and lymph nodes in this area. And then I rotate my hand either in a counterclockwise or a clockwise position, starting from the outside and then working my way in toward the center under the areola. You will notice that I'm using my hand as a spatula, and I'm rotating my fingers and pressing the breast tissue against the chest wall so I can see if I can feel anything under my fingertips. While I'm doing the examination, then I'm thinking, well, what if there is a lump or a mass there, or I have really lumpy, dense breasts, I can't tell what's there. The important point is that you check to see if there's a change in anything that has been there before. If you notice that there's a change, that needs to be evaluated. And as you can see, I'm slowly working my way in toward the center until eventually I will end up at the areola, and I will always examine behind the areola or the nipple to make sure that there's nothing behind it. And that took about 30 seconds. You then can do the opposite breast with the opposite hand or the alternate hand, and that will be the end of your self-breast examination. Now, this is a very quick and simple method for breast examination, and it only takes a minute of your time. So this is why it's so important and so simple to do self-breast examinations.
Really? No, I don't know.
Really?
I had no idea.
No.
No, I didn't know that.
So now, are you ready to do the ultimate selfie?